Hello, my name's Kathy Bissell. Welcome to the Golf Show 2.0. Our guest today is Dr. Gautam, and he has worked with Justin Thomas and Bud Cauley on, I have to read this, musculoskeletal health, regenerative medicine, and elite musculoskeletal performance. Correct?
That is correct, Kathy. Thank you for
Okay.
that introduction.
But it's mostly that we were interested because you have seems a specialty in golf, and once you've worked with two golfers, all of a sudden you're going to get 30 at your door. So
Everybody has a back issue at sooner or later
Exactly.
in golf. So
That's
tell
100%
us about
true.
how did you get into this
Yeah,
specialization?
what we do is, right, I'm a founder of a company called NUORO Wellness, and we focus on musculoskeletal longevity, particularly honing in on like the fascia, so this connective tissue system that
yes,
integrates movement, force, and recovery, all these things together. So at our practice, we use a host of technology that we've kind of invented, where we take advanced diagnostics from 3D gait and movement analysis, couple that with AI, and then we look at the tissue with ultrasound, effectively trying to identify patterns that let us know where the body is breaking down or where it may break down in the future. Similarly to how high performance cars are come in for maintenance, we see the body very similar to a high performance vehicle, right? So what we focus on
A
is
lot of people have compared me to a high performance car as a
you
golfer.
you you
That's
look
very
like you look
common.
like a Shelby Cobra.
Yeah,
so
a shell of a cobra. Yeah, that's about right.
so really, like, we don't treat pain. We're focused on restoring the underlying system that kind of controls movement. So
okay,
fascia is something I'm sure you guys are aware of, but it's starting to become more and more prevalent in kind of mainstream conversations regarding wellness, recovery, even performance. And effectively the fascia, just like to extend Gary's car analogy, just like the fascia of a vehicle, right? The fascia of the human body is this layer that's kind of connecting everything else together, right? So it's like this three-dimensional web that's or like a netting that has a specific tension to it. And when everything is balanced, you're able to, for the topic of today, you're able to go through the entire golf motion with no effort, right? And no resistance. And as we start to get injured, we start to see, whether we're aware of it or unaware of it, changes that can happen to the golf swing based off of physical potential limitations. Let's say with the amount of flexibility you have in your thoracic spine, that's like a huge one, right? Um, like in JT's example, he had obviously was recovering from back surgery, but we asked the question with Colby, who is his trainer and has been for many years. When I met with them, the topic of our conversation was, let's try to understand why this thing happened. Because look, you've had a surgery, and obviously nobody, including yourself, wants you to have another one, right? So can we understand, was the surgery or was what happened that needed to be intervened surgically something that just happened, or did it happen because of something else, right? And that's really kind of the pathway we went down. And we always ask ourselves, how is somebody moving through space? And the golf swing is such a complicated motion, right? And it's one that has so many different intricacies. And you can find that, if your posture is a little off because your back is sore or your lower back has gotten tighter than it should, that can have profound implications into how you deliver the club, and if you're delivering the club incorrectly, right, because it's an asymmetrical sport, it's just a lot of times, golf injuries aren't like, let's say, like a tennis injury or something where, or an impact sport where, let's say, you like rupture your Achilles because you're driving to the hoop playing basketball. It's like a death by 1,000 cuts, right? It's like micro trauma that happens over and over and over again. And if you're not either A, super in tune with your body, or B, just, have another set of eyes that's watching you swing, you know, like you can start doing things and you're not even aware that you're doing them or why you're doing them.
How did Justin Thomas, to quote Humphrey Bogart's famous line, of all the gin joints in the world, how did Justin Thomas walk into yours and get connected to you?
Yeah, it's a great question. So we met through a mutual friend of ours, Will Ahmed, who's the founder of Whoop, you know, and very big in the golf and an incredible golfer as well. But we met, you know, Will and I know each other. He was a patient, you know, without getting totally into his story, had something similar to what Justin was dealing with. We were able to help him avoid surgery. And, you know, he was so thrilled with the results that he obviously, you know, called his buddy Justin and just kind of shared with him like, hey, look, I think there's something else out here you should look into. And then, you know, we went down the pathway of, you know, we obviously spoke on the phone several times. You know, you have to make sure the personalities get along and people understand what you're saying and does it make sense to them. And then I met with his trainer, Colby, who's an amazing guy, works with a lot of golfers down there in Jupiter. And, you know, what I was saying, I think resonated with them. And the really cool thing about our procedure is that, you know, the risk reward ratio is skewed highly in the favor of the patient, you know, because you don't have to go under general anesthesia. You're not having you know, a really invasive procedure. It's done under ultrasound guidance and with needles and then injecting this regenerative fluid that allows us to remodel the tissue. But in no way is it like, invasive stem cells, or you're not sore for weeks like with PRP potentially, or obviously recovering from a surgical procedure. It's nothing like that. So I think it's more harmonious, and, you know, it made sense to them, and, you know, and we tried it.
Okay.
Justin is a University of Alabama guy. You said you grew up in Louisiana. Was he okay with
I think our SEC connection was immediate because I went to LSU, and then his trainer Colby is from Baton Rouge and was at, I think, at LSU for a while also.
I don't know. LSU and Alabama is a pretty big rivalry. I know.
I know. Hey, look, it's like the peace. You know, we can coexist in the world.
We need more of that.
100%.
I was having some problems with my back, and my doctor recommended physical therapy, and the physical therapy experts told me that my problem was not really my muscles, it was my fascia. And I had really not heard of fascia before. And I have a vague understanding of what it is, but every time I get twinges here and there, it's usually the fascia that are causing me a problem and not muscles and tendons. Can you explain to people how that can happen?
Yeah, 100%. You bring up a great point. And traditional rehab focuses a lot on strengthening and range of motion. And, you know, when we're talking about the fascia, this is kind of taking it a layer deeper and understanding how the tissues are sliding and communicating with one another. So oftentimes after surgery or an injury, the fascia can become scarred and sticky, right? So basically, if you think of things as like layers of paper mache, if you have an injury, that paper mache, instead of, you know, being one layer flat over the other, can kind of get can get like stuck and twisted and knotted. And those abnormal force patterns can then cause a person to start to feel different things, right? And what does Tiger always say, right? Feel and real are two different things, right? So when things start to feel different, then players can start to compensate or do other wonky things, and then can further throw their bodies out of alignment and get, you know, injured even further. So why golf is so, you know, interestingly hard on the body is because this asymmetrical loading at high torque, you know, and high rotational speeds is, you know, so you're effectively loading the same tissues, especially the spine and the hips, over and over and over again. And if that machine isn't, or that system isn't totally in balance, you will wear it out faster than you would normally, right? It's just the equivalent, again, to a car analogy is, are the axles, you know, are the tires balanced and rotated? You know, if they're not, then the tires, you know, if your alignment's off, then you're going to wear your tires out faster than you're supposed to.
I might have a fat tire, which isn't the same as a flat tire. I know. So obviously, I assume one of the things you do at NUORO Wellness is you have exercises or things you give people like us who have a lot of miles on our cars, so to speak. Obviously we want to do preventative things. What kind of things can people our age and any age who are golfers do to keep their backs from blowing up?
Yeah, so I think mobility, like yoga and Pilates is probably the best thing you can do, simply because you're neutralizing your spine a lot of times, when you're on the reformer. So then you can really isolate small muscle groups and really kind of focus in proprioceptively on kind of symmetrically loading and exercising your body. But it's really, at the end of the day, it's flexibility is the key, right? Like, the stiffer you get, then the more tense you are. The more tense you are, then you're like muscling the ball versus effortlessly going through your, kinetic chain. What we do at the practice is, let's say you two were to come in, and if you're ever in Miami, if you're going to come here for like the PGA event at Doral, you should come by the office, and we can, happy to take you through kind of our in-depth analysis. So you come in, we put this marker, this suit on that has all these markers, just like they, for video games. And then we have this camera array, and then we have you walk, do various mobility movements, even potentially swing a golf club. We track all of that data. Then our AI analyzes it and then tells you where you may have injuries now, where they may be happening in the future, where the problems are happening with the fascia. And then we validate that with the ultrasound. And then we're able to confirm and say, hey, look, this is an area where the fascia has gotten too thick and stiff, and this is why you can't load into your right hip, for example. Or, this is why you can't, your shoulder is stuck here in the cuff. This is why you can't externally rotate your trail hand and shallow the club. So we try to help people understand how they're moving, so that then they can lock in. My body feels like it's moving like this, and this is why it's moving like this. And, the more you start to understand yourself, the better it is, the more control you have, just like in golf, right? The more you understand the swing, the more you can control the ball.
You said you're totally obsessed with golf. How did that come about, and when, and when did you decide to take your practice and make it golf related? But yeah,
it's a great question.
You're all into golf.
I'm 100% in. I grew up playing tennis and soccer my whole life. I thought, and then, as a physician, and then I started and sold a couple companies. So I never had, unfortunately, I didn't grow up playing, which obviously my children, it's going to be the complete opposite. Our niece and nephew already are in like the junior PGA thing. So, but if you don't have the luxury of growing up playing, you have to have the luxury of having a lot of time if you want to be good, so I was fortunate enough to start to get more free time in my 40s, and now I've completely gone down the rabbit hole. We have a simulator in the office. We play multiple times a week. My first round was last January, and I think I'm at about a 15 handicap now, so I'm trending in the right direction.
That's great.
Yeah, my goal is
golf is a game that's perfect for people with a lot of free time, a lot of money, and they need more frustration. So the free time thing, number one, right away rules you out as a doctor.
Yeah. Well, I make time because it's like a physical meditation for me. And the thing about golf that's so beautiful, it's this journey inwards inside of yourself, right? Because the only opponent is like nature and yourself. There isn't anybody else you're competing against. So it's this fascinating, like, how do I understand myself better, right? And control what's going on in my head, and at the same time tap into that consistent muscle memory. It's a beautiful game. I mean,
you can write off that simulator because
100%.
It's research, baby.
Even the Mura clubs, even the Mura irons,
Yeah, it's all a write-off. It's research. You have to have those. We'll back you up at the hearing.
Exactly. So, that's so. Just to kind of, for folks like you guys, right? It's the main injury comes from the rotational deceleration, right? So as you're releasing the club and then controlling and decelerating through your lead hip, and if you're right-handed, like that left lower back, that's where most people start to have a lot of issues. So doing exercises that focus on core strength and range of motion and mobility is really the name of the game, right? Because like everybody's going to start to get a little weaker as you get older. You could maybe counterbalance that by like changing the kind of shafts you're playing, right? Maybe you go to like a graphite shaft versus a. I could talk about golf all day, by the way.
Great. That's why you're here.
That's what yeah.
Well, Brandel Chambly was just talking on a Masters conference call about some of the guys who they were talking. There was a thing going around about the guys playing TGL and the simulator thing are seemingly getting hurt, which I think is just coincidence. And Brandel went on his long swing analysis saying it's the way they teach the modern swing. It's all these guys trying to use their lower body for resistance and not the traditional way, the guys who make a turn and lift their left heel up and let it swing through like a Scotty Scheffler. Those are the guys who don't have problems. It's the guys who are learning this other method, which is very common, that you're kind of trying to go against each leg on your swing. And those are the guys who are hurting their back injuries. And, Justin Thomas was one of those guys. And he named some others who I can't think of at the top of my head. But to really go down the rabbit hole, how you swing also affects your likelihood of having a back injury, apparently.
1,000%. So, it's all about, right, like, because there's so much emphasis on like club head speed, right? You're going to get club head speed the most by like rotating your body, like the shallower you can make the club, the more you're like swinging it around your body versus, like the more angular velocity you're getting. Guys that are getting into that really pronounced like C, like where you're really kind of bent over sideways, that's where you're, I love Akshay Bhatia's swing, right? But he's another one where he is like violently swinging, out to in across his body. And, he's like bent over like a candy cane, right? When he's hitting versus, Scheffler's like the best example of delivering the club. Like he obviously shallows, but his angle of attack is really steep, in comparison to some of these other guys. So for sure.
Will Zalatoris.
Will Zalatoris, I was going to say, yeah, right?
C, and he's had a couple of surgeries already.
Yeah, exactly. Right. And back surgery in your 20s is nothing to scoff at. Like that's, back surgery is terrible always, if you can avoid it. But, you start to, if you're getting operated on in your 20s, particularly if you start getting hardware put in there, that's a slippery slope. So yeah, to your point, the modern swing and this obsession with club head speed at all costs, for distance is, like Bryson swings like Mo Norman, right? That like single plane swing. And I think that's why, he's able probably, to not be injured even as hard as he's swinging. He's got like that very unique swing path versus some of these other guys.
He did have an injury, but I don't think it was his back. Didn't?
Look, most of these guys, if you're playing golf 4, 5, 6, 7 times a week, your lower back's going to be sore. What you're doing about it. And you may have a twinge here or there, right? Like you got to get out of the rough someplace, right? And you try to swing harder than you should. These things can happen, right? They're pro athletes, but I think. Look, one of the things that since Tiger came on tour is like, everybody is more obsessed with their fitness and recovery. And as the whole wellness and recovery space evolves, I don't know if this is a true statistic, but it seems like 8 out of every 10 golfers is wearing a Whoop, right? It's obviously monitoring their recovery and their sleep. Justin Rose, I hear, is traveling with this like wellness recovery RV van thing that he's like retrofitted that has red light therapy, cold plunge, this, that, and the other, right? So, and he's playing some of the best golf of his life, right, at 45. So I think the amazing thing about golf is that it's something that you can take with you your entire life. But the thing that all of us golfers, our biggest fear is not being able to play golf because of an injury, right? So how do we minimize the injuries? Is doing things like, we spoke about. And then, if you're able to explore kind of preventative models or regenerative type of therapy, right? Like what we're doing at our practice, we're not only trying to help people recover from injuries, but then also optimize their performance so that they can even play better, right? With
Now,
less help.
Bud Cauley had a different set of problems, I'm guessing,
Yes,
than
he did.
Justin Thomas, because he was in a very serious automobile accident. He broke some ribs, and I've forgotten the laundry list of things that he had going on, but he probably needed to rehabilitate a bunch of body parts.
Yes, ma'am. So Bud, I met Bud through his mother-in-law, and he was involved in a car accident, fractured his ribs, and then had a very complicated post-surgical journey, right? So had to get operated on multiple times. I think the surgery site got infected once, maybe even twice. They had to basically they went in there a bunch of times, right? What ended up happening after that was the anatomy had gotten so distorted that he had gotten what's called complex regional pain syndrome. So it's almost like nerve damage that occurs in areas that have been operated on, or you can have like acute trauma too, right? So you can think of that, all of that increased swelling from the injury, infection, et cetera, distorted the anatomy and effectively pushed his nerves, and his nerves had gotten fused to his skin, so that if like a sheet touched his skin or he coughed the wrong way or whatever, right, it would be extremely, extremely painful, like pain out of proportion. So what we did for him was, something substantially different, where we basically reconstructed the chest wall and tried to release the nerves from the scar tissue, reconstruct the fascia, and basically kind of put Humpty Dumpty back together again to allow him to, regain life as a normal human being. So that was a more protracted journey, but one that I'm obviously thrilled to have been part of the team that got him back, right? Because he's such a great guy and a wonderfully talented golfer, and you hate to see talent and potential be derailed by injury. Like that's the last thing.
Are people coming to your clinic to do preventative exercises and things, or do you not see people until they've already messed up and hurt themselves?
So we've launched the world's first musculoskeletal based longevity membership. So people are signing up. It's almost like concierge medicine specifically for your musculoskeletal system. So you can come in. It gets you access to the procedures at a much lower rate. You have access to all the diagnostics. You have access to our other care team, so other physicians, nurse practitioners, physical therapists, etc. So we like to holistically take care of people. So you come in, the first thing again is like a very comprehensive assessment, and then we put together a treatment plan, based off of an individual's goals, right? So if Gary, your goals are, hey, look, I want to be playing golf for the next 15 years, no pain whatsoever. My lower back is sore now, but I'd really like to be able to play 36 holes in one day, and then, I want maybe 10 or 15 yards more off the drive. Then these are all
mainly that.
Yeah. So that is going to be from your hips and lower back being stiff. So, right. Like, so that decreased, when we play with other folks, we see the same thing, right? Like, so we play with some of my friends' fathers who are, they're great golfers, but they're just, the distance is decreased because they're just really stiff, right? If you can't create a large arc, you can't really get a lot of speed.
Yeah. So if you
have a treatment plan called How to Hit It Longer,
I do.
It'll be standing room only for that.
I do. I actually do. So, because we've worked with a lot of weekend warrior golfers where when we unlock their hips and lower back and even their thoracic spine, if you can rotate more, you're gonna hit the ball further, and you're gonna be less tight. It's such a complicated thing, but such a simple thing, the golf swing, right? That's why it's so amazing.
Where can people find you online?
So NUOROWellness.com, and we have and then we have clinics in New York, Beverly Hills, and in Miami, And then in the summer, we have a pop-up clinic in Aspen.
Okay, well, you're in all the good spots, that's for sure.
Indeed.
Hey, what's the? I have to ask you before we go. What's the single most memorable golf shot you've ever hit?
Oh, I was playing with two of my friends in New York, and I hit probably a 70-foot putt with like completely, you know, if the cup was here, I mean, completely went up the ridge and trickled it down and went in. It was incredible.
Was that for a birdie or a par or what?
No, that was for birdie.
Nice.
Great.
And then I followed that up with,
that's longer than Tiger Woods, better than most putt at.
Yeah, but then I followed it up with a double bogey, and I'm pretty sure he did it. You know?
Yeah, I gave it right back. It doesn't matter.
Yeah,
I
exactly.
one shot, you know.
Yeah, I mean, so you know where I'm at right now, my golf journey is I can hit. There's amazing. I think that's why we all play, right? There's like the greatness is inside of you. It's just, but how do you tap into it consistently? You know, like I'll hit an incredible shot and then two bad ones. You know,
step one is to be able to hit a really good shot flush, and at least you know it's in there, because a lot of people never get to that step.
Yeah.
And then step two is to improve the batting average, because you know you can do it. Now, why can't I do it?
Exactly.
80% of the time. So
exactly.
If you've got the good shot in you, that's you're ahead of half the people who play golf.
Well, I appreciate it. I'm not going to stop.
Golf are generally not that athletic. That's why pickleball is so popular. You don't have to have any skill whatsoever.
Yeah, it's very accessible
to play pickleball. You don't have to be able to move. If you can play ping pong, you can play pickleball, and it gets you out. And of course, people are still getting hurt left and right.
I was about to say that the injury rates are higher than that of tennis.
It's hard to believe. I guess I don't know how they're doing that. I mean,
well, it's because right when your hips get stiff, then you start bending over with your lower back, and because you're basically kind of in a crouched position, hitting like a lot of low shots, and it's like a lot of starting and stopping, you know, and lateral movement. You get knee injuries, Achilles ruptures, but then a lot of lower back injuries because of just the position
and they probably didn't warm up, didn't stretch, and they aren't really in shape to start with.
Well, the one thing I always wonder is how Jack Nicklaus, how his back didn't hurt, considering he was so hunched over the way he putted, right? And think about the millions of practice putts he hit. It's incredible. You know, like I think about that all the time. Even people like their posture when putting. You know, like you're doing this for hours and you're like hunched over like that. It's crazy.
Well, he had good advice from people growing up, and he already had distance, so he. You know,
no. I'm not doubting him. I mean, I'm just saying it's a miracle. Yeah, it's incredible. You know, to think.
So he worked on his putting, and he already had distance just because of his physique.
Yeah, he had one or two minor glitches with his back. I think it kept him out of the Masters one year, but
but basically he was
pretty good. His longevity was incredible.
Incredible. That's what I'm saying, right? Like it's incredible.
Tom Kite hit balls all day long, every day.
Right.
He didn't have problems either. He had incredible longevity and even VJ longevity.
Right. Well, yeah, VJ is now battling. I mean, but now you see he's got like this foot injury. But these guys are, especially like the Jacks, Tom Kite. I mean, the equipment that they were playing with is so heavy, and they're fine.
Yeah. Don't know. I'm gonna guess heredity, luck. Whatever you want to call it. Tom Weiskopf had a beautiful golf swing and could hit the ball a mile.
Yeah.
I don't remember him ever being sidelined because of injury.
He's sidelined now because he's deceased. But
I know, but he's playing in the big golf course in the sky.
That's it. Right. Well, check him out at NUOROWellness.com. How to fix your back and how to hit it longer. It's something I think every senior golfer would be interested in. You can find your office. You have offices in Miami, New York, Beverly Hills.
Yep.
Thanks for being here today, Dr. Gautam. Good stuff.
Thank you, guys.